Hello everyone, welcome back to the channel. Our brain controls nearly everything we do. But have you ever wondered how it communicates with different parts of the body? The answer lies in the cranial nerves, 12 pairs of specialized nerves that connect the brain directly to the head, neck, and even parts of the body. These nerves allows us to see, hear, taste, smell, move, and even regulate vital functions like heart rate and digestion. Today we will explore the 12 cranial nerves in detail, breaking down their functions, pathways, and clinical significance. By the end of this video, you will have a solid understanding of how cranial nerves work and why they are so crucial in medicine, neuroscience, and daily life. So let's begin. Cranial nerves are like highways that connect the brain to different parts of the body. Unlike spinal nerves, which branch from the spinal cord, cranial nerves comes directly from the brain. These 12 paired nerves have specific and specialized functions. Some are purely sensory, some controls muscles, and others do the both. Without cranial nerves, we would not be able to see, taste, hear, or even smile. So, understanding them is crucial for neurologists, doctors, and anyone interested in human anatomy and physiology. Let's now look at how these nerves are classified. Cranial nerves are divided into three main categories: sensory, motor, and mixed nerve. Some carry only sensory signals, like the optic nerve for vision, while others control movement, like the oculomotor nerve, eye movement. The most fascinating ones are the mixed nerves. They have both sensory and motor functions. A great example is the facial nerves, which helps us express emotions, blink, and even taste food. Now let's explore each of these nerves in detail. Olfactory nerve is the first cranial nerve and plays a crucial role in our ability to smell. It starts in the upper nasal cavity, where specialized sensory receptors detect odor molecules and send signals directly to the brain. Unlike other cranial nerves, this one does not pass through the brainstem. When damaged, a person may experience anosmia, the loss of smell. This can happen due to head injuries, viral infections, or neurodegenerative diseases like Parkinson's or Alzheimer's. It's fascinating how something as simple as a scent can trigger memories, emotions, and even psychological response, also physiological response. The optic nerve is the gateway to vision. It transmits signals from the retina to the cross to the brain and allowing us to see. Interestingly, the optic nerves from both eyes partially cross the optic chiasma, ensuring proper visual processing and depth perception. Damage to this optic nerve can result in blindness, blurred vision, or visual field defects. Conditions like glaucoma, increased eye pressure, or optic neuritis means inflammation can harm this nerve, affecting eyesight permanently. Oculomotor nerve is responsible for most of our eye movements. It controls muscles that allow the eyes to move up, down, and also inward. It also controls the pupil size, adjusting how much light enters the eye. When damaged, pupil may experience double vision, difficulty in focusing, or ptosis, means drooping eyelid. A common cause is nerve compression due to aneurysm or diabetes related neuropathy. The trochlear nerve is the smallest cranial nerve but plays a crucial role in eye movement. It controls the superior oblique muscle, helping us look down and inward. If this nerve is damaged, a person may experience difficulty in looking down, making tasks like walking downstairs so much challenging. This is often seen in head trauma or congenital defects. The trigeminal nerve is the largest cranial nerve and has three branches responsible for sensation in the face and controlling chewing muscles. One of the most painful conditions related to this nerve is trigeminal neuralgia, causing extreme facial pain triggered by simple activities like brushing teeth or touching the face. It's often managed with medications or surgical procedure. Abducens nerve allows us to move our eyelids outward, means laterally. It's essential for eye coordination and depth perception. Damage to this nerve leads to double vision, often seen in conditions like brainstem, strokes, or elevated intracranial pressure. Facial nerve is crucial for our expressions and emotions. It allows us to smile, frown, and even raise our eyebrows. Additionally, it carries taste sensations from the front two-thirds of the tongue and controls the lacrimal, means tear, and salivary glands. A well-known disorder affecting this nerve is Bell's palsy, which leads to sudden temporary facial paralysis. This condition is often caused by viral infections like herpes simplex and can resolve over time with proper treatment. The vestibulocochlear nerve has two primary roles. The cochlear branch is responsible for hearing, transmitting sound signals from the ear to the brain. The vestibular branch helps maintain the balance and spatial orientation. So, damage to this nerve can cause hearing loss, tinnitus, means ringing in the ears, dizziness, and vertigo. A disorder called Meniere's disease results in sudden episodes of vertigo and hearing impairment. Glossopharyngeal nerve plays a role in both taste and swelling. It transmits taste sensation from the back one-third of the tongue and helps with the swallowing reflex. It also regulates the parotid salivary gland. So, damage to this area or this nerve can cause loss of taste, difficulty in swallowing, means dysphagia, and a reduced gag reflex. This is often seen in neurological disorders like stroke or Guillain-Barré syndrome. The vagus nerve is one of the most important and longest cranial nerves, traveling from the brainstem all the way to the heart, lungs, digestive organs. So it controls functions like heart rate, digestion, and speech. Damage to this vagus nerve can cause hoarseness, affecting vocal cords, swallowing difficulties, and irregular heart rate. Stimulating this nerve can even be used in therapies for epilepsy and depression. Accessory nerves is the mainly responsible for controlling the sternocleidomastoid and trapezius muscle, which allows us to move our shoulders and turn our heads. Damage to this nerve results in weakness in the shoulder elevation and difficulty turning the head against resistance. This can happen due to neck surgeries or traumatic injuries. Now, hypoglossal nerve, which is the motor nerve of the tongue, allowing us to speak, chew, and swallow properly. Damage to this nerve can cause difficulty in moving the tongue, making speech and eating challenges. This is often seen in stroke patients or those with neurodegenerative diseases. Testing cranial nerves is essential in diagnosing neurological disorders. For example, facial asymmetry may suggest a stroke, while hearing loss could indicate inner ear damage. So, these tests help doctors identify nerve dysfunction early. So, that wraps up our deep dive into the 12 cranial nerves. We explored their functions, pathways, and clinical significance, a crucial topic in human anatomy and physiology. Understanding cranial nerves is the key for medical professionals, students, and anyone interested in neuroscience. These nerves controls essential body functions like vision, movement, taste, and even heart rate. If you found this video helpful, please support the channel. Hit the like button to help more learners discover this valuable content. Subscribe for more high quality, in depth medical and science tutorials. Share this video with your classmates, friends, and colleagues who might benefit from it. Also, let me know in the comments what topic you would like to see next. I am always working on new, exciting educational content to help you learn better. Thanks for watching, and I will see you in the next video.